It is official, the pandemic's effect on America's waistline has been rough. New data from the Centers for Disease Control and Prevention showed 16 states now have obesity rates of 35% or higher. That's an increase of 4 states: Delaware, Iowa, Ohio, and Texas, in just a year. The findings confirm what several recent research studies have found: many Americans gained significant weight since the COVID-19 crisis started, likely fueled by an increase in sedentary behavior, stress and troubles like job and income loss that make healthy eating harder. And those rates are rising faster among racial minorities. Obesity continues to be a significant public health crisis, says Dr. Nadine Gracia, a physician and president and CEO of Trust for America's Health, a health policy group that recently analyzed the CDC's 2020 data. And growth in childhood obesity, she says, projects a worsening trend. The pandemic only exacerbated a problem that was already quickly accelerating in the last decade. In 2011, not a single state had reached the threshold of 35% obesity. Now, among the 16 at that level, a handful are very close to 40%. The rates are higher in the South and Midwest. The latest CDC data is based on a survey of people self-reporting their own height and weight, so if anything, the new data likely understate the problem, says Dr. Fatima Cody Stanford, a leading obesity researcher at Harvard Medical School. When patients are reporting or individuals are reporting. So I think that this report will undercapture, actually, the degree of obesity in the U.S., she says. Stanford argues that obesity's growing prevalence has not met with adequate recognition that it is a disease. And because it goes largely unrecognized or untreated, it does not surprise her that it continues to increase, especially during difficult times like the last year and half of the pandemic and its economic and social fallout. When we look at factors that play a role in rising obesity, we know she says stress doesn't just affect exercise and eating patterns. It also prompts the body to store more fat. During the pandemic, other factors, including food insecurity and reduced access to recreation, made it more likely that everyone from children to older adults would gain weight. Other research supports the finding that obesity rates increased in the pandemic. A March survey from the American Psychological Association found 42% of Americans said they had gained more weight than intended, 29 pounds on average.